Today, I'm really pleased about that. Involve is a national organisation primarily in England rather than the whole of the UK, funded by the government to promote public and patient involvement in research. So I think our interests chime really closely with what UPAT is about, and we're really keen to find out more and see how we can work together. I think it's probably useful just to say at this point that the tradition of involvement in the UK is slightly different, it feels like, from other countries in Europe, in that we have more of a practice of involving individuals in research, so people come and get involved rather than as involving through patient organisations. So that probably gives a bit of slightly different flavour to what I'm going to talk about today. We have over the years built up quite a stock of resources and support for helping people to get actively involved in research. So I think these range from a wide range of different activities, introductory events, role descriptions, workshops and manuals. But what we've not done in any way is brought them together in a kind of unified or coordinated fashion. And so it's a work in progress that I'm going to talk about a little bit today, that's trying to do that a bit more in an integrated way for England. And also our thinking about this is moving on all the time. The more we think about it, the more we think about, we rethink how we're conceptualising the things that we need to do. So we did launch a training resource last year that set out some essential principles, but that was very much a starting point. And our thinking's moved on from that. And as part of my role at Involve, I'm coordinating or facilitating a small working group of representatives from across the National Institute for Health Research. And that's our organisation in England that provides the funding and infrastructure for the research carried out in the National Health Service. And so in this small working group, we're exploring how we can work towards a more integrated approach for learning and development. And that's the second phase of the project that I set out in the abstract, if you've had a look at it yet. So we've just started with that working group. We've had one meeting so far. There's at least one person here who was part of that group. So I think it was a good start, an interesting start, and led to some really useful developments in how we're thinking about learning for involvement. And that's changing, really, the way that we approach our task to do that in a more coordinated way. And my task today is I'm going to fill this empty box with 3 ideas that have emerged from our recent conversations around that. But I just wanted to flag up before I do that, like others have already spoken about, we're obviously very interested in learning and development for patients and the public, but we're also really interested in the learning and development needs for researchers and research organisations. It feels like without their real understanding of what this is about and what value patients are bringing to improving the quality of research, but then also how to make that a reality, what they need to do to put that into practice. I liked the analogy earlier on where it's about, it's not just the empty seats, it's making sure the seats are there. So organisations have to be ready and willing to do that. It feels like we're not going to get very far if we're only looking at one side of it. So we did do a project last year which was developing a resource around training and support. There are some postcards outside on the information tables, if you haven't seen them already, that give you the web address to have a look at that. As part of that, we set out some essential principles for training and support. But what we did at that point, we were taking quite an organisational view. We were thinking, what do organisations do to be able to help and support patients to get involved? And our really thinking in the small working group that we're just starting out with is actually to turn this around, to turn that on its head. And so instead of thinking about what do organisations do, let's start with the people that are getting involved, or the researchers that are going to be involving people. Let's think about the learner and put them at the centre of it. So we're starting to think much more about a learner-centred approach. And so what do we mean by this? And I think it's been set out in the introduction to this session already today that educating patients needs innovative methods, but also needs to be adapted to people's needs. And for us, that seems to be highlighted around 2 particular factors. So the person, what the person has already, what skills and knowledge and experience are they bringing when they get involved, and then also the role that they're going to be undertaking. So what task is it that they're going to be asked to do, and what are the gaps in their knowledge and skills to be able to do that? And some people might have larger gaps of knowledge, and other people might not have quite so much. And this has really been informed by thinking about adult learners and adult learning approaches. And then we're interested also in the quality of learning and development opportunities. So how can we make an assessment of the quality of any learning materials or opportunities? Patients and the public who are getting involved might need to make an assessment of this to decide if it's a good use of their time. And organisations who are commissioning something might also want to know, is it something they should invest in? So we would begin to think about whether there's a set of principles or standards that can be applied to have an assessment of quality with all these various different resources and developments. And so we haven't got very far in our thinking about this. We've just started thinking we need to be thinking about what those quality measures are, quality markers. But there's a couple of things that have come out from recent discussions with a wide range of different people. Firstly, this idea of co-learning, which I think was mentioned earlier on, where patients and members of the public are learning together alongside researchers and people from research organisations. And then also co-construction, where members of the public are actively involved in the design and delivery of learning opportunities or learning materials. And the feedback that we've had from people who've put this into practice, saying the scope for real transformational learning to happen when people are working together in this way. So it feels like that some kind of standardised model or fixed pathway might not be the thing that helps us get where we want to be. So we've started to think about a flexible framework that gives people choice, and there's a range of methods included in that. And so it's really helpful to see the different range of methods that people have been talking about, both the vision for the UPATI project and then the example that we just heard about there that included a range of different things. So people have choice about what, how and when they learn related to the specific role or task that they're involved with. And so although we don't have a clear picture of what this flexible framework might actually look like in practice yet, so I suppose we think it's going to include a wide range of things, written information and guidance, groups, workshops and courses, innovative practical activities, self-directed learning tools, learning on the job, which is something that people don't always think about, but shadowing others, doing and then reflecting, networking, shared learning with peers and using different technologies. So it feels like we're at an early stage of trying to think about how we can bring this together across the National Institute for Health Research and get a more coordinated, unified or integrated approach to learning. But coming to the conference is a really fantastic opportunity for us to share our thinking as we're developing it and to check this out with others and hear what others are saying and join in all the conversations that are taking place. So thanks for having us.